Good evening. My name is Kenneth Carson, and this is my critical assignment on public health history through the modern day. One of the major themes of the history of public health is who bears the responsibility for maintaining public health. The question is, does this go to the federal level? Does it go to more local levels? Or does it belong in the hands of private or non-governmental institutions? Throughout the United States history, just in general, there has been a lot of controversy. Has been more like there was a lot of controversy between whether there should be a lot of power on the federal level or if states should have the power. And so as public health was developing during the 1800s, so was the concepts that would guide how public health is managed today. So today, the states in the United States are usually the people who are managing the public health at that level. So state level institutions and government will be the ones responsible for maintaining the public health of their populations. When it comes to non-government institutions, either volunteer organizations or private organizations or nonprofit organizations, collaboration between government and non-government institutions usually has positive results for improving the delivery of healthcare. We actually can see this happen, maybe less so in developed countries, but a lot in underdeveloped countries, where developed countries send resources over to underdeveloped countries. But the best way to make that work is for governments to provide resources and transportation, but non-government institutions to actually perform the services that make sure that people in those underdeveloped countries receive the health care that they need. But it's a very complicated topic, but when it comes down to it, collaboration between government and non-government institutions provides better delivery of healthcare. So this theme has major impacts on health and wellness when it comes to resources. Usually the federal level has more resources, while local levels do not. So sometimes the federal level has to manage and give resources to local levels. It has to do with laws that are set in place. For example, if healthcare laws are set at the state level, then a new law about healthcare in Arizona isn't going to apply to laws in California. But if it's important enough, they would make it a federal level law, and that would make it applicable to the entire United States. But it's important to understand that the level at which you're looking at public health law will affect the actual public health of everyone involved. This also affects oversight. So a state level institution will be overseen by the state level government. So understanding that if there are malpractices or unethical situations going on at any levels of the government, they will also likely be affecting the public health system of that level, and thus reducing the ability for that system to provide health and wellness to their population. And lastly, focus. Focus is one of the main reasons why the United States performs public health at the state level. Since the federal level is so high up, it's hard for them to focus on smaller communities in a small city in one of the 50 states. But with public health being maintained at the state and local levels, it allows for those organizations to have a lot more focus on the smaller communities in the populations that they serve. Another major theme of public health, especially in more recent years, is the theme of healthcare access and delivery. The essential question here is determining what groups within the public have access to healthcare delivery. And this became very important. In 1950, there was an era in public health where people were really focused on filling gaps in public care delivery. So people not being able to receive specific services or just public health services in general. There was a lot of attention paid to that. And with that, a lot more questions being asked regarding whether groups are able to receive public health care equally, especially groups that might not receive it equally based on race, gender, language barriers, their financial situation, immigration status, or any other characteristics that may hinder their ability to receive health care. In recent years, the way people have been working towards equal healthcare delivery have been through spreading education about illnesses and treatments that are available, trying to reduce the stigma regarding who should receive healthcare and who shouldn't, and who should avoid going to receive healthcare, encouraging help-seeking behaviors, especially within the public, so that they know that they are able to receive help if they qualify for it, and removing external barriers and facilitators so that the people who aren't receiving healthcare can have direct access to the public health resources that they need. So this is an important theme for health and wellness, because healthcare services are received based on whether or not a person has access to the public health system. So if we want the entire population to be able to receive healthcare services and become healthy and well, then we need to make sure that there's equal access to all members of that population. A significant advancement in the history of public health, this is a very early one, was the Age of Enlightenment and the Age of Reason. And this is because this was a key historical factor that changed the perspective of sickness and health. So before the Enlightenment, a lot of cultures saw sickness as something very spiritual. So if someone were sick, it would be a sign that the gods were displeased with that person. And usually that person would just be outcast from the society. Now, because of the Age of Reason and because of its development of science and rational thought in general, it created a cultural environmental factor that allowed for health and medicine to be studied scientifically. And this is what began the science of health and medicine. So this environmental factor was crucial to allowing scientists and doctors to begin academic and scientific work that would later create medicine and public health science. So clearly, not only is this important for just public health in general, but also the health and wellness of people all over the world today, because of the Age of Enlightenment, we have medicine, we have the means to diagnose and treat illnesses and injuries because of the Age of Enlightenment and because of the scientific studies that were created because of this change in environmental factor. Another environmental factor that usually leads to advancements in public health is the actual public health conditions. Basically, if there are poor public health conditions, then it creates a high demand for those conditions to be changed for the better. And this usually also results in public health being advanced because of that demand. So, for example, in the 1800s, industrialization was taking place. So was urbanization, which meant that, very hot factories, people cuddled together. And then same thing when people left the factories and went home. There were a lot of people squished together in cities, and there wasn't a developed sewage system yet or a sanitation system. So these conditions are what allowed people to see, hey, we need to fix this. And it's what led to the development of germ theory, which would later lead to the development of vaccinations. So in general, actual health conditions and how they affect advancements in public health simply just make health and wellness better, because they allow people to focus on health conditions that can actually be improved. Now, this was a very major achievement in public health, vaccinations. So in the past, whenever infectious diseases would break out in a country or an area, the only way they could deal with those infectious diseases is by separating healthy people from sick people so that the sick people don't infect the healthy people. back in like, well, for almost all of history until the development of the first vaccine in 1796. Um, People would just outcast people who were infected until they were healthy again, if they ever got healthy again. There would be no cure in order to be well again after being infected by an infectious disease. And there and whenever people died from infectious diseases, their bodies would simply be disposed to avoid healthy people from becoming sick from those dead bodies. So the development of vaccines meant that there was another option to deal with infectious diseases and that they could actually be cured. The first vaccine in 1796 was made to deal with smallpox, and 200 years later in 1997, we actually eradicated smallpox. We defeated every last trace of the smallpox disease, and so it proved the effectiveness of vaccines and allows us to, instead of just dealing with the effects of the vaccine, actually stopping the vaccine or actually stopping the infection itself. So when it comes to health and wellness and public health, this provides protection not only for individuals, but also for an entire population. If you ensure that vaccinations are spread throughout an entire population, that will protect most of the population from receiving infectious diseases because of the vaccines that make them immune or resistant to those diseases. So, as stated earlier, one of the most important changes in public health was the Age of Enlightenment. This allowed for the science of medicine to be developed and be created. And because of the science of medicine, we're able to use medicine to heal people, which, improved health. And when it comes to wellness, people were actually able to get well after being sick, because instead of just being outcasted for being sick, they would actually be treated for being sick, and they would get the care that they need. And when it comes to the public health profession, there really wouldn't be a public health profession at all if there wasn't for the Age of Enlightenment, because there wouldn't be any scientific study or any reason to learn about medicine if it wasn't for this cultural change. So it created the necessary cultural change for healthcare to exist at all. Another important change in public health was Florence Nightingale's changes to nursing, and then also just in general hospitals and sanitation. So regarding health, Florence Nightingale created a school for nursing, and in that school she created education standards for nurses and these standards are still standards that we have our standards based on today. So these education standards also provided legitimacy for the profession of nursing. And because of these higher standards, people who receive healthcare from nurses, nurses that graduated from her school would have positive health outcomes because of the standards set in place. When it comes to wellness, patients were also under better wellness standards because basically Florence Nightingale worked on the front lines in war, and she realized that sanitation was a major issue that caused a lot of soldiers to die, because even though a lot of soldiers were dying from injury sustained in combat, there were still many more soldiers who died simply because they got infected after those injuries in combat. So Florence Nightingale developed sanitation standards, and in turn, those sanitation standards reduced the number of soldiers who died from infections by a significant amount, and she actually got rewarded for it with money, and she used the money to create the nursing school. But it improves patient wellness and also wellness in general if you ever receive healthcare, because those sanitation standards protect patients and keep them from getting sick. When it comes to the public health profession as a whole, her sanitation standards are used in hospitals all over the United States and all over the world, really. Um, and the standards that she developed for nursing provided the foundation for standards we have now for nurses, doctors, other public health care professionals. And it also provided a lot of reputation to the profession of nursing. Before, nursing wasn't considered a worthwhile job, but after her school and the work that her graduates performed, nursing was given a lot more legitimacy in the eyes of the health system. And lastly, education became an important part of developing nurses of the courses that she because of the success of the courses that she taught in nursing. It proved that education was a good option to improve the competency of the public health workforce. So the learned course content that we've learned in this course is the objective of the Healthy People 2020 publication, defining the term public health and what exactly public health is, describing the history of public health and its key events and accomplishments, comparing state and local public health agencies and systems, learning about the role public health has in healthcare access, delivery, and law, describing how the public health infrastructure affects disease outbreaks and control, discussing the 10 essential public health services from the CDC and how those are maintained, learning about different public health jobs, professions, and the qualifications required for those jobs, learning about nursing and the Florence Nightingale era and how those affected the types of nursing today and the educational requirements for those different types of nursing jobs that we have today, the public, private, and volunteer entities in the public health system that each provide different services for the advancement of public health, the creation and distribution of public health promotional material and educational material, and comparing public health in the past and today, seeing how it's changed since then today, and then also looking towards the future, seeing how possible changes could be made to the current public health system to make better changes to the future of public health. So among the things that I've learned in this course, I think the most significant one is, number one, how to support public health as a member of the public. I've learned that there are many ways that you can do this by volunteering in public health volunteer organizations, by supporting legal legislation that provides more funding to public health or provides better laws to either protect the public or to advance the resources and abilities of the public health system, and also to help other members of the public around me receive healthcare by helping to remove that stigma against asking for help from the healthcare system and encouraging people around me, if they're able, to receive healthcare in order to protect the population as a whole. I've also learned a lot of important information to begin a career in public health. Currently, that's not in my career goals in the near future, but I'm trying to become a pilot, but if I want to become a hospital pilot, this course is definitely going to help me with that. So that's great. The resources provided by this course that have been helpful are the textbook. There was a lot of information in the textbook, but I thought that the information was still really good, well organized, and provided a lot of information that was really helpful to understanding public health as a general whole. The class assignments were also really good. Through those class assignments, I was able to, kind of conduct my own research, learn more about these different public health concepts through hands-on learning, not like nursing, but like hands-on research. And the discussions were able to allow me to communicate with my classmates and just present my own ideas either on their own or in replying to other classmates' posts. The only thing that I wish would be different about this course is if there was more classmate interaction. This might be difficult with an online course, but something like perhaps a group project or maybe discussions that were maybe smaller in length but required more of like a conversation rather than just one post and like replying just once to that post. But I wish there was more opportunities to interact with my classmates in this course. So the future of public health, there are a lot of different directions that these could go, but here are some possible positive directions that I feel like would help improve the public health system. Data is becoming increasingly important. I took a statistics class recently, and we learned about how statistical analysis and collecting data just increases the public health system's ability to deal with either infectious diseases or just health in general. So I feel like data collection is just going to become more and more important in the future of public health. Policy development is also going to become more strategic, I feel like. And with being more strategic, there may be more federal level and state level assistance to local level policies and state level policies. So that's something that we could see in the future. This one's going to be kind of hard to explain, but there will likely be less direct organization between directors of health at the state level and their governors. One thing that I noticed is that California's public health system doesn't have the director of public health report directly to the governor. Instead, there are a lot of different channels for a lot of different reasons, either for ensuring healthcare access, equal healthcare access, and then there's other channels like health councils for different areas of public health. And when in one of the assignments we compared two different states, and I compared it to Arizona. And in Arizona, there was one director of public health who reported directly to the governor. And that director of public health had maybe 2 deputy directors, but that was it. And that could be just because of a lack of manpower at that organizational level. But I could see in the future there being a lot more emphasis to provide councils and other management levels that deal with access in order to ensure that equal healthcare access is available to people who receive healthcare from the public health system, rather than it just being in the hands of the public health director and that person just solely reporting to the governor. I also see there being more local level accountability, states having more accountability over local level organizations, and the federal level having more accountability over the state level organizations. And I also see that in the future, there's going to be a lot more awareness for mental health and also resources for improving the mental health of the population as a whole, simply because that is an issue right now that is currently undergoing a lot of growth than it has seen in the past.